Queen CB, I see you. And Queen CB, Kezia is random questions. Kezia told me to talk about family planning. Kezia, there are so many family planning methods. Which one specifically do you want me to talk about? There are so many family planning methods. Or do you want us to talk about all? Now, It's time to talk about random issues, just random issues. I'm still at work, and I can be talking to my people as I'm doing some issues, as I'm doing some things here. I can be talking to my people as we do ABCD. So, which question do you have? Kezia, I see Kezia was around. Where has Kezia gone to? Kezia, which topic do you want me to talk about when it comes to family planning? Just tell me any topic and I'll explain. Kindly talk about one for 3 months. I've forgotten the name. That one is called Depo. It is called Depo Provela. Depo. It is progesterone only pill. That injection, yes, that injection, it's called Depo. You know, when you are injected with Depo, this goes to Kezia. When you are injected with Depo, Depo is the name of the company that produces, but the hormone itself is progesterone. Yeah? I have really tried to remember the name. You have really tried to remember the name. Okay. Now, Depo is the company name, but it is progesterone only. It inhibits ovulation. And you know, if you don't ovulate, you cannot be pregnant. It suppresses releasing of gonadotropin releasing hormone, of gonadotropins. So to go faster on this matter, Kezia, there is something called gonadotropin releasing hormone from your brain. So these gonadotropin hormones, it releases it stimulates the release of two hormones, which are follicle stimulating hormone and luteinizing hormone. The work of follicle stimulating hormone is to prepare the follicles to be ripe so that they can produce good eggs for fertilization. And then luteinizing hormone, its work is to make the uterus and the environment good for the flow and the fusion, what we call conception. So when you take progesterone, the mucus thickens and the endometrium thins. So if the mucus thickens, the sperm swimming becomes the problem. Implantation again becomes a problem, because implantation, once when the ovum is formed, it comes when the uterus is thick, the endometrium are thick, it has space to implant. So it reduces motility, the flow of sperms. But the problem with this, it is a hormone. It cannot cause infertility, but it delays. I think that topic, when we were talking about it, you were not online that time. We talked about this topic. So mechanism, it stops two hormones, luteinizing hormone and follicle stimulating hormone. By this, it makes ovulation not to happen. So if ovulation is not happening, you know, when ovulation is happening, someone feels nice and warm, and when the eggs are being released and in the mood, you get. So if the other thing, it thickens cervical mucus, blocks sperm to flow, prevents fertilization. Endometrial atrophy makes the endometrium to be thin. You cannot implant in the uterus anything. So it prevents pregnancy. The only problem with this thing is if you are used to it and you have hormonal imbalance issues, you want one day to get a kid, it can take so long before you get a kid. You get? It can take you so long, because now if you are used to you are used to secondary you are used to secondary it's secondary infertility or delayed fertility. So that is how it works. And once you start using it, you have a problem. You start using it. Once you are injected, there is no antidote. There is nothing that you can be injected so that it reverses until the effect goes away. Until the effects goes away. But it is safe for people. We talked when we were talking about heart issues. There is a lady who asked about safety when it comes to people who have heart conditions. It is safe for people who have heart condition. Estrogen is the problem. Estrogen is the problem. Femiplan, the combined pill, is the problem when you have heart issues. Yes, Kezia, what else do you want to know? What else do you want to know about this? This Depo progesterone only pill. What else do you want to know? Tell me what else do you want to know about it. I will answer. And when traveling to Africa, I should take Atovaquone, Proguanil 200-100 with my meal. Can you explain? That is Atovaquone, Provaquone. The component, it sounds like an anti-malarial. You know, some drugs, Queen B, when you sound them, they sound like an anti-malarial. When you travel to some countries, you must take some drugs that are helping you not to get some diseases from those countries. So when you are traveling to countries like Africa, we have here more disadvantage. My sister Kezia wants to know the disadvantage. Okay, let me answer Queen B first. So Queen B has been in Africa. Just imagine, Queen B has been in Africa, and I didn't know. Queen B, the next time you'll be in Africa, please let me know. Let me know you are around. You see, it's good to know. So this is King Red. More disadvantages. I'll answer that. Let me answer Queen CNLB. I would really love to know her real names so that you check, so that I could be calling, like how I started knowing Judy's name. Judy's name. J. King, we are used to. I'm coming to Kenya. Oh, really? So there is something when you are traveling to malaria zone, you take some drugs called prophylaxis. Prophylaxis helps you when you are exposed to those diseases, you don't get the disease. I went to Zimbabwe before. So this is for Queen. When you came to Africa and you had to take that drug, it was preventing you from contacting. It was preventing you from contacting malaria. You get malaria. So that is why you had to take that, because in most African countries there is malaria, which is spread by malaria is spread by a mosquito, and not all just mosquitoes, Anopheles mosquito. That's why you took. Even Jamaican uncle, when Jamaican uncle was in Africa, he came and I gave him, and it really helped. And it really helped. So, King Ray, anything you can ask. I see Queen has answered her question. Answered Queen Grace. So some more disadvantages about there is a question here that Kezia had asked, more disadvantages of this drug. What are the disadvantages of this hormone called Depo? Yeah? once you have taken it, Kezia, once you are injected with 150 milligrams of that, you cannot reverse. You see, maybe you had issues with your man or your somebody, and then you impulsively, I really experienced negative side effects with that. That's why I went to know about it. Okay, and then you go and you are given. One thing you will get is menstrual irregularities. Sometimes they come, sometimes they don't come, because you are not ovulating and the cycle is not regular. Sometimes you can experience so heavy bleeding, sometimes absent menses. So I can see new people checking in. If you are a new person, please hit the like button. Don't fail to subscribe. Just subscribe and say, I am new here. What is going on? Yeah. And then the other thing is delayed return fertility. And then the other thing is when you are used to progesterone pills, weight gain. People really get weight, associated with increased appetite, fat accumulation. Progesterone pills, when it comes to infertility and fertility pills, they increase weight. And then most of the time you are tired, and after long use you can get problems because of your bone mineral density. Long-term use can reduce bone density due to decreased estrogen levels. You see, when progesterone is high, estrogen goes down, and estrogen helps when it comes to bone density, particularly concerning in adolescence and premenopausal. Bone density is often improved after stopping the injection. So don't always be using progesterone pills. It's better you use the combined one. And sometimes, high progesterone levels in your body can cause headaches, mood swings, depression, breast tenderness, because when progesterone is high, it says you are pregnant. And when you are pregnant, your breasts are, yes, low libido, experience menses for 6 months straight. I was really worried. It is, that's why I say, when you use it, there is no going back. Fatigue and dizziness. So, when you are using this, it stops ovulation. And when you are ovulating, that is the time that women have more libido, when you are ovulating. Or am I wrong? If it is the truth, please tell me. Women libido is better when they are ovulating. But now there is no ovulation because you have used Depo, which is progesterone injection, 150 milligrams. Imagine. So libido reduces. Height Finest say, hello doc. Height Finest. Today we are just talking about random issues. What do you want me to talk about? Or answer you, or specify? Anything that you feel doc should answer now, it's the time. Ask me anything that you feel doc should answer. I'm fine, Height Finest. If you are watching and you have not liked, please, the floor is open. Like, subscribe. When we are chilled like this and we are doing some things like at work and I'm not busy, it's time that my people can ask me some questions. Can ask me anything, like Kezia, and she has asked me about the Depo, and I have answered. She wants to know more about disadvantages. You see, Queen has asked, I'm a gym instructor and I kept on adding weight. What was I supposed to explain to Kezia, that is where you get confused. That is where you get confused, because if you are a gym instructor and you are adding weight and people are coming for you for advice, I almost forgot to like. No worries, no worries. Stan's Kitchen, good evening, doctor. Busy day for me to follow your beautiful lectures, but we'll find time to go through regards. Stan, no problem. Right now I'm just answering random questions and talking to people that we interact. But don't forget to give me a like before you go, and share to a friend. You get? Don't forget to give me a like. I like likes. So you see, when you are adding weight and you are controversy, people start saying that this gym instructor is a hoax. They don't know what you are undergoing. It's like being a doctor and you are taking medicine for diabetes, and sometimes you take when the patients are sick. They will not understand. They will say this is a hoax. You see, now that is a good one. Anyone with any question? But I think you stopped using. And now you are using. Now you are using the daily pill. Daily pill has estrogen and progesterone. We appreciate your time. I enjoyed your young man yesterday. How old is he? I was really impressed. There were three of them. The first one is a lady. She is 9. The second one is a boy. He is 2 years, and there is one who is still suckling, being held like this. Both of them are jovial people. Very jovial. When you are around them, you never feel like leaving them. You see? So, Kezia, when you want to balance your hormones, you stop using it and you wait for some time. If it is not working, you start using combined therapy. But waiting is the only thing. You see? So any question of anyone who is here that has a medical question that we can talk about, anyone who has any medical question that we can talk about, to open. Yes, six watching. Yeah. Six watching. Let's continue. Sometimes when let me tell you a secret of coming online, and you know that you are impacting people. Even if you impact 1 or 2 and they get better, you see someone feels so nice. And when you interact and people interact back to you, you make new friends that you've never met, but you interact and feel good. I only used it once. I don't want to use it again. Let me feel the earth in peace. Yes, that is a progesterone only pill. It is open ground now. People who are watching, if you are watching and you have a question, it is time to answer. My question is up there. Which question, King Ray? I have not seen it. Let me find out. Where is there any other effective way to lose weight apart from exercising? Just asking. King Ray, this question is a very complicated question to several people. How can you lose weight? Losing weight. There are several steps that one can lose weight. But I usually say, as much as you want to lose weight, you should make sure that you are losing weight in a healthy way. You are losing weight in a healthy way. Exercising, okay. Sometimes network disturbs people when they are actually listening. There is a cut, network comes in. Now, let's talk about losing weight. How to lose weight a healthy way. How do we lose weight in a healthy way? Because detox, how do you detox? Kezia, there is nothing like detoxing. That is not a medical term, and I explained. Go to the videos of detoxing, and there is some videos I talked about detoxing and antioxidants. So just know there is no medical term like detoxing. It is only it is only one organ in your body that does detoxing, and that organ is the liver. So if you feel like I will explain, but check on my videos that I did antioxidants and detoxing. They really explain what that means. So our sister Judy has asked about cutting weight. Cutting weight. How do we cut weight in a healthy way? One, Onik is here. Let me say that if you want to cut weight in a healthy way, first of all, if you are on any drugs that are steroids, you stop. If you have stress, hi Onik, welcome to the channel. I'm just going round answering random questions. If you are stressed up, some people when they are stressed up, add weight. I don't know if you have ever got such. When someone is stressed up, that is when this person adds a lot of weight. This is because when you are stressed up, your brain produces a steroid, catecholamines. My day has been good at Queen. So these catecholamines, they are steroids, and they increase production of fats and some other aspects. So if you are that kind of person who, when you are stressed up, you add weight, the first thing you should do is you should relax and stop. So you should relax and stop getting stressed up. Eat less carbohydrates. There is this diet that is called the keto diet, that you only eat protein. You know, when you eat carbohydrates, you eat chapati, cornmeal, ugali, you eat rice a lot, cutting weight will be a problem. Why? Because the carbohydrates that you take a lot, they go and they are turned into cholesterol, and they are deposited in your body at the belly, somewhere there. So you continue adding. So the best thing when it comes to cutting weight is you reduce carbohydrates, you start eating proteins and vitamins. If you are on any drugs that are steroids like prednisolone, all those you stop, because they have a tendency of adding weight. See, they have a tendency of adding weight. The other thing is there are some things that you, when it comes to cutting weight, like if you see you have reached somewhere that you cannot manage, you can visit a doctor and prescribe to you some medicine that can stop the process of absorption of more cholesterol and lipids, so that you can reduce weight. Eat less over a short period of time. So that the food that you are eating less can break down the carbohydrates, can break down the process when metabolism needs energy. So the little food you eat, it's used in metabolism instead of adding. So the main thing that you should do, you should eat less carbohydrates, eat less carbs. It is a secret that people don't know. You can be exercising and then you go home because you are hungry. You take a lot of rice, a lot of chapatis, a lot of, you see, you will not be doing anything. After exercising, you come back and you do what? You put back the calories or even more. So if you feel catching up has been a problem, there are some drugs that you can be prescribed and they cut weight. There are some people even who go to surgical procedures to lose weight. They inflate balloon in the stomach. They inflate balloon in the stomach so that when you eat, you are eating and you feel satisfied faster, so you don't eat so much. Or the other thing that is surgical, what they do, they go and they resect your intestines so that they can be short. Absorption of food to be less. You know, when your intestines are not so long, they are short, absorption of food becomes less. So you can't wait. There are some drugs when you take them, they don't reabsorb glucose at the kidney. The reabsorption is cut down. So when their reabsorption is cut down, what happens? You lose the energy that you need. The problem with those drugs, every time you feel dizzy, because even keto diet, every time you feel dizzy because you don't have that glucose or the energy that you need always to push you, to keep you pushing. So those are the ways that you can have to go through to cut weight, and I think those are good methods. But you see, if you go to an extreme of surgical methods like trimming your intestines, balloon methods, there you've gone to a place whereby now it is you know, I want this and I want this. The surgical procedures should be the last options. The last option should be surgical procedures. So it is random question, guys. It's random question, guys. Who else has another question? Today I'm just talking randomly about questions. We have had a question on prophylaxis. We have had a question on family planning. We have had a question on weight management. But don't seek weight reduction when you are breastfeeding. It's not good. You are being unfair to the kid. The kid will lack food. Seek a doctor's advice before you start weight reduction when you are breastfeeding, when you have diabetes, when you are hypertensive, or you are undergoing a heart disease, because it can be pathological. Sometimes even cutting weight is pathological, and fasting is not cutting weight. But I believe eating more protein is the best way it comes to losing weight. Yes, it is called keto diet, Kezia. It is called keto diet. It is the best way. Very simple. You see, it is the best way and very, very simple. So who is that who is new today in the channel? Who is that who is new today in the channel and watching Benjamin the Wise Guy as we talk about some things medical? You know, when I started the cancer topic today, I thought some people will freak out, because some people, when you tell them about cancer, the next thing they think of is death sentence. The next thing they think of is death sentence. But I've seen people coming in, people appreciating, very silently wanting to know about cancer, and today we have talked about breast cancer. We have talked about breast cancer, and it has been a good topic. And I'm going slowly by slowly, because when people are not medics, sometimes we should make them understand. I just subscribed and liked one of your videos. Thank you, Queen B. There are so many videos I've made on medical issues. If someone wants somewhere this person can learn about mental health, things concerning depression, things concerning the long-term issues when it comes to solving issues, thank you, Benjamin, have learned a lot. Welcome. I have a very long playlist of mental health, and that playlist, you can go through and leave a question there, then I'll answer. I'll answer back when you need. Because I've realized many people are bound to myths and not facts when it comes to medical issues. You get? Because now, like the question that Kezia has said about family planning, there are some people who say once you start those family planning, you'll never get a baby. And there are other religions even they don't use, and we respect that because it's their choice and you can do nothing about it. So I really appreciate when you want to find information, when you want to come and find out, why is this thing happening like this to me? Why am I going this side and this side? Some medical, and when you, Haiti Finance said hi IT Finance, welcome to the platform. Today we are doing just random evening talk, a random evening talk. If you have any question that is medical, or any question that you've been thinking of, and it has been giving you hell of a time. My net is misbehaving badly. It's not yours only. I don't know what is happening. Net currently has been deciding to give us headaches, IT Finance. So you just ask, come with your question, ask, let's get going. Let's have a platform where you can get some answers. Even when your doctor is not around, someone can follow up and on this channel and get an overview. It is good sometimes before you go to hospital, you have an overview of what can happen, what the doctor might do, enlightenment, having some support everyone. Onik is a very good guy. Onik supports everyone. And please go also and support Onik. Onik, as you support people, let people come through for you too. So you see, because you remember when we were talking about, don't forget to subscribe, very beautiful channel of, yes, very important. I remember we were talking about, when we started about cancer, some people are saying cancer is something that comes and kills. It's a disease, a stranger. Okay, Kezia, no problem. It's at night, and I'm just at work. I have 1 hour, so I just decided to come and we say in Kenya, beat up some stories or answer some questions. So that is it. You see, sometimes people say that cancer is something that comes and eats your body, a stranger. But today we have realized it's not a stranger. It is you yourself, the cells mutating and becoming something else. You get? Becoming something else. You, your cells of your body mutating and becoming something else that are not the cells that you always have. You see that? So, my friends, Don't. This is a channel that when you are seated with your friends and you see a friend is suffering from something for so long, this is a channel that you really need to tell your friend, I have a friend online. I think subscribe to that channel. You may get some help. You may get some help. And when that friend of yours comes here, you find that we are doing good and we help everyone. Information. I'm not selfish in information. Me, I give 100%, 100% of information. 100% of information. Especially where I know best, I'll give you 100% of information. So, my friend, who else has any question that is burning, any question that has been these friends of ours have asked and asked and asked, but the friend is not getting a solution. We have got a question on, I think, Judy, if you are still around, I've answered your question well concerning exercise. Hope if you are still around, I've answered your question correctly. When you are, or when you'll come back, you can tell me, Judy, if you are around. I think I have done the best, and you are satisfied, because satisfaction is better. And I hope you take care of yourself about health-wise. Yes, take care of yourself health-wise, because it's the most important thing that you need to make it happen. So we talked about rehydration. You remember salts of the body, sodium, phosphorus, potassium, the foods you should eat. We talked about them. Yes, and it really encouraged more people, and some people that were at that specific talk. So I'm trying to do some work as I listen to the people around and waiting for your questions. Of course, anyone who has a question can come in and ask me any question that is medical. Medical questions are not just diseases. People think medical questions are just diseases. No. Consultation entangles. Hello, Benjamin and everyone. Evelyn Minage, welcome. Evelyn, you've gone so silent. You've gone so silent. What's up? Are you still at Nyabohanze? Evelyn Minage, you've gone so silent. I haven't seen you around. Check out the group. People miss you there. They want to talk to you there. They want to see you there. They want to see Evelyn Minage. They want to see Evelyn Minage. Today we are just talking about random questions. Anything that is burning that you have in mind. Yes, I'm in Nyabohanze. Oh, nice. I've seen your videos there, Evelyn. But visit the group. Do something. Support the group. Don't let no people miss you. Let no people miss you. Okay. So anything that you have in mind, anything that you've been having burning you, and you want to understand, even if it is a simple thing, please bring it here. Or if you have a discussion, a medical discussion, there are some questions and there are medical discussions. Medical discussions are big topics, like the topic. There was a topic whereby we were just talking, and then a friend came out with a question like, does staying long without romancing and intimacy have a problem? It became a very big topic medical. You see, so there is no question that is not big or small or confusing all questions are questions, and let's take them as they are. So, what's your question? What is your question? What do you think you have in mind that may help us to move forward and sustain a healthy mind? Because health is sustaining good physical. Don't forget the live stream. Very nice. Physically fit, without disease, and a healthy brain. That is when we say a person is healthy. Physically fit, without disease, and a healthy brain. You see, that is when we say a person is physically healthy. Mental health. What do you think about mental health, my people? My people, what is the but I'm always in the group then? Yes, I see you there. I see you there. But we haven't. I'm saying that because we haven't talked so much. You this week we haven't talked Evelyn. You know, when you start forming friends and you don't talk to them in 2 days or one, you start feeling you are missing something. Yes, you start feeling you're missing something. Yes. So there is something called mental health. People have neglected that thing a lot. And you see, mental health is every disease starts from the brain, or where? And bacteria affect even the brain. So you may not be suffering a physical disease, but you are suffering a mental issue. A mental issue. So check out any problem that you've been having mentally. Sometimes we go down, sometimes we feel that everything is not okay, and you start feeling your BPs are going up, your pressure, blood pressure is going up, especially those people that are nowadays. I've realized one thing. It's not only parents that are having high BPs, even children. Children in campus, children in some vocational trainings. You get these children that stress is making them to have hypertension, stress. While we thought it's adults only who can get hypertension. Have you ever asked yourself about that? Or have you ever been close to a person who is young, still in college, and she or he is undergoing stress issues, and this person is having hypertension? It is confusing, yes? It is really confusing. It's very confusing. But the things that we expose our children to are the ones which bring these issues. The things that we expose our children to. Someone may say that food is part of it, of course. But there are some things we expose our children to because we say now the world have changed and we need our children to be exposed. You get, some people say we need our children to be exposed, and the exposure is another thing that is there. Exposure is feeding our children with messages. You feed our children with bad media, influence that you yourself you are not brought up with, and because you feel that you've made it and you want everything to be independent, you expose your children to this type of issues. So depression starts because they follow media that is not okay, and then our children start to have that depression. Food, junk food, because you like them, you start buying them foods that are not okay. Before they go to college, they have piles of fatty free plates. So bad media in the mind plus food we eat. A child at 22 years has started having hypertensive disorders. Health-wise, imagine. Parents now that goes to parents. What do you think we can help our children to avoid these things called lifestyle diseases? Lifestyle diseases. What do you think about lifestyle diseases? And what are lifestyle diseases? What are lifestyle diseases as per your thought? What are lifestyle diseases? Lifestyle diseases, hypertension, diabetes. You are not born with diabetes, but because what you eat is brings diabetes because of insulin resistance. Because of insulin resistance. And then every time before this child gets to 30 years, you are in hospital, in and out. And in your family, you've never had problems when it comes to insulin resistance. So those are issues that we need to discuss. And that's why we come online and talk about them. We come online and talk about these issues because we need to save our generation. You know, when a person grows, you are always proud when you have a generation that is coming that is healthy, a generation that is good, not a generation with cardiovascular diseases like hypertension, heart attacks, a generation of type 2 diabetes because of insulin resistance, obesity, cancers. And you see, cancers, we talked and we say they come because of some problems, food we eat, and genetic makeup. You saw today we started on breast cancer, and you saw those problems that come. You saw that those problems that come of breast cancer disorders, problems linked to lifestyle, and problems linked to genetic disorders. You know, sometimes you can have a genotype factor in your family that is linked to cancer of, let's say, the one that we are speaking about, cancer of the breast. But because you take care of yourself, even if you have that genotype that is causing it, because you take care of yourself, what happens? Just a minute, I can see something. Yes. I'm back here. I was talking to some people and then I was called. So we were talking about saving our generation, and saving our generation is an important thing. It entails everyone to protect our children from the diseases that are lifestyle diseases. I've talked about them. Osteoporosis, weakening of the bones due to poor nutrition, and then a child has depression at ages of 23 years. At ages of 23 years, depression. You start taking antacid, proton pump inhibitors like omeprazole, and then your bones starts to be weak. At an early age. You see, it's not good. We should protect our children at an early age. Everything that we are doing, all these things that we are learning, all these things that we have learned, even these ones, heart diseases, congenital heart diseases. You find we talked about heart diseases, congenital, that babies are born with. Babies are born with heart diseases just because when the mother was pregnant, this mother was taking foods that she was not advised. You are pregnant and you are taking alcohol. Men, if you are new here, let me see. Are you new? Please text me to the chat if you are new and watching me. Let's see if you are new. Who is new today watching me? Or this is the first time you are coming to the channel? Is this your first day in this channel as you are watching? Or all of us are friends? If you are new here, please tell me I'm new. I enlighten you what we do in this channel, so that you can understand what we do. Because just getting to a channel and you don't know what they do, sometimes people get confused. But you see, the good thing is you can go through the topics that we have done. And then you know what we do, and then you feel good. So you guys let's continue talking. Let's continue conversing. If anyone has a question, if you have a question, medical question, or you want to know me, who is the host, you want to know me, it's a good thing knowing someone. Hit up a question there. Give me a question there so that we can converse and get to know each other. Today is that day we say a good day. That good day. And answer time. It is question and answer. Let's continue talking. Let's continue talking and talking. Let's continue talking and talking. Okay. Who else has a question? I've answered several questions. Who else has a question? If you have a question, please. If you have a question, let me answer you. Medical question or random question, any question. Yes, any question from the people. This is the Coffee Cakes Love. The Coffee Cake is here today. Coffee Cake, hi, long time. How is you, Coffee Cake? How are you doing? We haven't talked for some time. We talked and then things became, I think the time that I come online is even a challenge to some people because I have followers worldwide. So doing okay. And you? I'm fine, Coffee Cake. I'm still at work, as you can see. I have some time, so I just decided to come online and answer some random questions. So people are asking me questions, medical questions indeed, some medical questions, and I'm going through them. and I feel good when I'm answering. So, Coffee Cake, which state are you? Remind me which state you come from, which state you are from. How is life there? How is life on which the state that you are in? Hope it is okay. Hope you are doing fine. Hope you are doing fine. Oh, from Coffee Cakes, Mexico. I always wanted to visit Mexico. Their music, their way of life, the sceneries. Mexico has some places that have good sceneries, but I'm not traveling this year. I have so many things I'm doing. Maybe next year meet New Mexico, USA. Okay, New Mexico. Maybe next year meet there. I can travel around. And get to know new places. But Mexico, what is good in Mexico? Coffee Cakes. There are some diseases that are not in Mexico, like tropical diseases. When I travel, the only thing I'm doing is I'm going around and talking to physicians, talking to doctors, getting to know how they operate in their countries, and also having fun. When you travel, you want to know the ways of people, you have fun, you interact. Hope Coffee Cakes, you've liked the video. Hope you have liked and you have shared to your friends, your good friends. Yes, Coffee Cakes, I'm a doctor. You have not subscribed to my channel, Coffee Cakes. I'm a doctor. Yes, Mexico have good food, very good food. Please, Coffee Cake, if you have not subscribed to my channel, please subscribe. Please subscribe. I'm a doctor, Coffee Cake. I'm served just recently though. Okay, yes, I remember we were talking with you when you were subscribing. Yes, I'm a doctor. I work as a doctor. You see what I've put on? I'm in a hospital, but in my office. I'm in my office right now. It's at night. Here it is 10:44 p.m. here. What's the time where you are? What is the time where you are? Yes, I came in once you were outside, I think. Yes. What is the time where you are? What do you do? Are you a student? Oh, it is 1:45 p.m. Okay. 1:45 p.m. Oh, I see. Okay. That is nice. Have you taken lunch? What do you do in life? Are you a doctor like me? Do you work in a hospital? Are you a student? Anything that you do. 1:45. This is 10:45 and I've not gone home. So, Coffee Cakes, if you have any medical question, I'm here to respond to any of your questions. Any question that you think can be helpful. I'm here to answer you. It is important that I be here and also answer some people. Yes. Can see more chats are coming. Okay. Coming. Fun. I was in banking for 22 years, but then had a bad outcome of back surgery. I've been disabled since 10 years now. This is October. Oh, what happened to the surgery? Are you in a wheelchair? Or what happened? Did you get an accident? Or the problem came after the surgery? But I had an outcome of back surgery. Okay, I am sorry about that. So it means that when you went to surgery, you started to have complications, and the complications have piled up. What was the diagnosis? What was the diagnosis of the surgery? Because when you go to surgery, We do the surgery against a diagnosis. We just don't do the surgery. We do against a diagnosis. And maybe your diagnosis, okay. I'm waiting for your question. So anyone who is coming in right now, please don't forget to like and share. If you have any medical question, you can ask. Went in for a laminectomy and disectomy. Doctor accidentally hit my dura and took all this. Oh, sorry about that. That is, I'm very sorry about that. Okay, it's okay, no problem. You will be okay. I think you are doing more exercise. Did they replace the disc? Because nowadays you can replace with the silicone or plastic one. So my left side hardly moves, but my right moves. Yes, Zanta Minecraft. Zanta Minecraft is in the house. Santa, hi, welcome. Have you subscribed or liked the video? Santa, here we are talking about medical. If you have any medical question, you can ask, but don't fail to subscribe, my friends. Subscribe. That is Zanta Minecraft. That is our new friend, Zanta Minecraft. Zanta, hi. Which place are you? Which place are you, Zanta? Which place are you? Which country are you from, Zanta Minecraft? Which country are you, Zanta? Can we get to know? No, he said it was better the bones fuse together. Now, because if the bones fuse together, sometimes you get pain. And you said the removal of the disc means some nerves were destroyed. And if nerves are destroyed, that means some part of your body will have a problem. Movement will be a problem according to the nerves that were destroyed, because laminectomy removes some portions of the vertebra, and the vertebra, some places is where some nerves come out, so the movement may be a problem. But I've seen some people that have done. Hi, greetings Benjamin and everyone in the chat. Welcome, Humble Marcia. We are just talking and answering some questions. The Coffee Cakes is here, and she has something that she had it. I've seen some people when they are done laminectomy and the nerves are destroyed, after more physiotherapy, if the disc was replaced well, sit too long and must. Yeah, I understand. Do you do any physiotherapies? Do you do any physiotherapies? If you are coming in, please like. Give us some like. Give us some likes, guys. Give us some likes. Don't fail to give us some likes. Let's get some likes. And if you have any question that is medical, or you have something medical to tell me, I'm here, please. I'm listening. We can talk. So I was in hospital for 9 days with the CSF leaking out of my back, and that could cause an infection. I think that was a very bad thing for that doctor. Was then on rehab for a month. I'm sorry about that. I'm really sorry about that. That happened was bad. It was bad. What I'll advise you for now, what you really need to be doing, you get some vitamins like B complex. B complex will help the nerve regeneration. Then I've done several plateaued. For now that you've gone through therapy and you've got this problem, the rejuvenation of the nerves and exercise can help, but very minimal under supervision. Minimal exercise. But what makes more what makes more nerves to be rejuvenated so that you can bring back the excitement of nerves is some vitamins like vitamin B complex, and there are tablets, there are injections according to how your doctor. Are you on any supplements? Supplements really help at this stage. Supplements really help at this stage. So you need some supplements, you need some vitamins, you need all the nerve regeneration capsules, so that even if it will take time and if you will be using the wheelchair, what you can it can help is at least start to return the excitement of nerves slowly by slowly, the excitement of nerves. So please, where you are, I'm so sorry about that procedure as it went like that. And leaking of CSF, cerebrospinal fluid, is a very critical thing. You can get an infection. You can get an infection, and it's important I say that. I'm sorry about that. Hope you are put on very strong antibiotics, good antibiotics. I don't like saying strong, so that you didn't get an infection that affects the brain. So for now, what you should be using, use more supplements to rejuvenate the nerves that were affected, because compression of nerves affects movement, and sometimes you feel tingling sensation the areas that are affected. So I know people make mistake. God has taken care of me, yes, and that's why at least right now we are talking. You see, God has taken care of you, and that's why right now we are conversing and talking and discussing of what happened. But please continue taking your supplements. There's little exercises that you can. Please continue doing them. Supplements really help when it comes to rejuvenation of nerves, because the side that the movement is there is no movement. It means when the disc was being removed, there was a problem, and the nerves were either compressed or they were cut. I can't explain because I didn't have an MRI, because the only thing that can explain that if you take an MRI. But for now, rejuvenation of the nerves that were destroyed needs some more supplements. And if you feel tingling sensation at your end of the fingers, extremities, the arm, the leg, take some aspirin, and take some things like anti-inflammatories to reduce the tingling sensation. Because if you continue feeling the tingling sensation, what will happen is it can cause some complications. Thanks for at least sharing that with us. I know God has taken care of you, and he will continue taking care of you until you are okay. So don't worry yourself. The coffee cupcakes, everything happens for a purpose, and now one day, you have testimony, and testimony is the greatest thing that you have. Don't just the only thing that I don't want you to have, don't bury yourself in depression. No, be strong. Let's overcome this. Take your medication. Do some things that you have to do when you feel pain. Take those drugs, anti-inflammatories. Let's continue with the grace of God until we are okay. Nice one. You see, people, at least interacting with people here, we continuously know what is going out there. But because some things like the cupcakes was a good lady, she didn't want many things. She said some people make mistakes and it's okay. It wasn't meant to be like that. So medically, we continue assisting this person as to get better every day and to improve the quality of life. And God will bless you, who is continuously helping someone to improve quality of life, and that is what we do here. Improvement of quality of life. Improvement of quality of life. So new people don't just come and watch new guys. Sometimes when some new people, when they come live, they don't like thanks doctor, welcome Betty's World. They don't like chatting. Someone just comes and listens and goes away, and this person has some information that he or she can leave. So it's important to leave us some information. And like the chat too. Like the chat and subscribe. So if you are here and you feel you have any question, thanks Coffee Cakes for that, for sharing with us that was so important. That was so important with us. We appreciate so much about that. We appreciate so much about that. Thanks a lot about that. Anyone with anything that you can add or anything that you can say to the people that are in the chat and watching, please, you are openly told. The floor is open. Add something, say something. We don't have a topic right now. It's because I'm just at work and I thought it's good. The levothyroxine that I used to take for my thyroid got me so swollen. I got hospitalized for the levothyroxine that for 2 years. All my sensations is back. Levothyroxine is T3. T4 that goes and breaks down to T3 is T4. T4 that goes in your body and then breaks down to T3. It is called levothyroxine, used to treat hypothyroidism. It works by restoring normal thyroid hormone levels, help regulate metabolism, energy production, because when you take levothyroxine, this is for humble Marcia. I'm explaining to humble Marcia what happened. So when you take it, it is T4, but when it goes to your body, it changes to T3, which now brings all those. I took multivits and B6 and B12. Yes, very important. While rare complications can occur, swelling symptoms and nerve damage may be due to one or more allergy or hypersensitivity. That is the first one. Maybe you are allergic to the drug. Sensitivity to the drug and inactive ingredients such as dyes or filter. Hambomasia, are you allergic to anything else? Like food or like clothes, anything, or fur? Are you allergic to anything else? I would like to know. Because in life, mostly getting someone who is a doctor, I have a call, will be back. It's okay. Coffee Cakes, it's okay. We are here, we are still here. So when you have allergy to some drugs, to some things, is where you get, yes, doctor, I said I was allergic to the drugs. Yes. Now, Coffee Cakes, let me tell you one thing. Not Coffee Cakes, Humble Marcia Lifestyle. Levothyroxine is the hormone that you have in your body, T4. And when you take it and you find allergic reactions like swelling, this may be results of maybe the components that are added in, or it is very hard to find someone who is allergic to levothyroxine, but sometimes it happens, like you faced it. Maybe you take the drug and then it interacts with another drug that you are taking and interferes with absorption, causing unstable levels, and then you start swelling on your face. Severe fluid retention because of the drug interaction. You get? But mostly when you check at that drug, some come as a capsule, and the capsule has an additive. You'll find that the capsule has been added some sugars, the gelatin, the top cover itself. You may find those are the things that you are allergic to. But you know, when you are allergic to something, even if it is one tablet you take and then it reacts because of the components that are added, it can be so severe until you be admitted, because an allergy can make you be so bad than even the drug that you are taking, because the drug is inside a capsule and there are some additives that they add. So if you took levothyroxine, I think the right way was they could take the drug itself without any additive. They try on you. If it doesn't get an allergy, then they will know the problem is not the drug, it is the additives or the gelatin that is used to wrap it. I think that is the best way to say. So, Marcia, which drug are you using now, substitute? Because according to your explanation, the levothyroxine that I used to take for my thyroid got me swollen. I got hospitalized for 4 days. My finger, you are not taking anything. My finger and my left feet got nerve damage. Because, when you took it and the allergy happened, the compression of the swelling and the nerves, that's why you got the nerve damage. So if you're not taking anything, I think you have a thyroid that is balanced, or some people go for if you have hyperthyroidism, some people go to surgery to balance it, and some people, if they have hypothyroidism, they replace the hormone by some other hormones. Sorry, I'm now on NP. Yes, NP is a good one. NP is a good one. NP is a good one. So that is it. Thyroid, as the thing you can do when it comes to thyroid disorders, is to reduce the hormone or to replace the hormone. So NP thyroid, it's the real NP is the real thyroid, but it's derived from other animals, but they help as human. They help as human. So it means you are having hypothyroidism. Yes, I'm taking high dose, so it's balanced now because I went to a doctor a few days. Yes, that is a hormone that you should take all through, because it is hypo. Your thyroid is producing less T3, T4, and you should have T3, or you can get direct T3 itself, and you'll be good. So no worries yourself. If you are balanced, continue taking your medication. Continue taking your medication until you are fine, until you are okay. So that is it, my guys. That is it, my friends. We continue talking. And if you have a question, don't fail to ask. If you have a question, don't fail to ask. Yes, Humble Mercy, I'm here at work. I've not gone home. I'm yet to go, just a few minutes. So if anyone has a question pending, can ask any question so that we can help each other. But tomorrow we are continuing with our topic, our good topic, that is, tomorrow we are continuing with our good topic, that that is what we are continuing with our good topic, that is cancer of the breast. And you saw how people appreciated it today. You know, when I was starting to talk about cancer, I thought people will freak out. But people have not freaked out. People are asking questions. People are asking questions, and they want really to know what this cancer is. So my friends, where you are, my friends, if you are a new person here, don't forget to subscribe. These things that we are talking sometimes may help you. These things that we are talking of importance may help you. So don't fail to subscribe to the channel. Don't fail to subscribe to the channel. It is important. You can have a certain problem and then you just come leave me a question there. I had a grandson who passed with Wilms tumor. Tumors are cancers, and Wilms tumor, some children are born with them, some they just come. Tumors, when you hear a tumor, know that we are talking about Wilms tumors are rare. They affect mostly kidneys, and they affect children. It is renal malignancy in childhood. It is called nephroblastoma. Nephroblastoma is Wilms tumor, most common kidney cancer in children. But nowadays it is rare. It is a mutation of the kidney. That one we'll talk. We are still talking about tumors. There are some genes and chromosomes that mutate, and then they don't perform the work of the kidney, of absorption, and so you pile up to, yes, it was the kidney, so his stomach was so swollen. Yes, but we found out very late. Yes, the stomach was swollen because of a condition called ascites. Because the kidney was not balancing toxins, more fluid was piling in the stomach, peritoneal layer, not inside the peritoneal layer. So it is a painless abdominal swelling or mass, the stomach. And hi Margaret, hi sister, just been on your live and I've come to answer some questions here. And it is 11. Imagine it's 11 now. So I know Norway. I don't know. I'm late. No. We are just continuing. I have some few minutes. So when you see a child, the abdomen is swollen, and sometimes they have blood in urine. It is 20 to 10. Yes, here it's 11. 11. So the child has, when this child is born, start presenting with a swollen abdomen, blood in urine, fever, high blood pressure when you are a child, loss of appetite, nausea and vomiting, and fatigue, shortness of breath. You know, we talked about the kidney, and you saw the kidney helps in balancing. The kidney helps in balancing pressure. So if the kidney is not balancing, Wilms tumor, if you are coming it now, we are talking about, someone has told us about, Hambo Masia has told about Wilms tumor. It affects children. Mutation of the genes of the kidney, they produce something that is not working halfway like a kidney. So you see, it's something that is swollen at the stomach. And because it is a tumor, urine comes out with blood, because you know tumors bleed because of vasculature. they start forming vasculature. You remember our topic of cancer of the breast. So even in the Wilms tumor, they form vasculature, and then you start bleeding. And nausea and vomiting comes because you have electrolyte imbalance. There is sodium, potassium, everything that is imbalanced. Always tired. So may the person rest in peace. We all say that God has a purpose, and each purpose has a will. So as doctors, we try our best, and when trying our best also, we sensitize the people, because there are some things that you can be born with because a parent did not follow the right protocols. Like when a woman is pregnant, you are supposed to start the folic acid there, because folic acid helps in the DNA formation of a child. But you have not started the folic acid. What do you think? What do you think? The child will start having the problem. I believe he was born with it because he was crying all the time, and he was just crying. Yes, Wilms tumor, because we call it angiogenesis. It starts from the conception. When a child is born, that is when it starts. So as this child grows, you may not note the complication, but as the child grows, now you start knowing that there is a problem. You see, it's a rare disease, but most of the people have realized that there is something like the Wilms tumor. You see? Now, and let's continue and say that is God and God is life. So let's always pray to God to give us life, and a healthy life, even if the doctors are doing their work. Let God be the provider of life, right? As we do all these things, we sensitize people, ourselves, and tell God that may your protection be vital, because He's the one who cares about us and carries day-to-day thing. So anyone who has any other addition or anything that you can say, if you have not double tapped the screen and you are a new person, just double tap and subscribe, and try to subscribe if you are a new person. You know, when I come at 10, it means I don't have any other work, and I have some little time before I go home. So that's why I'm here to, and you see, I've answered some questions and people are relieved and they feel good now. So if you're here and you have any other question, it's I learned a lot about it so far. So I'll be on the chat tomorrow. Oh, okay. Tomorrow we are continuing at 16:30 Kenyan time, 16 p.m. 16:30 p.m. We are continuing with breast cancer. If you have not started the topic on breast cancer, we learned about it today. Go to the GYN playlist. GYN playlist, there is that breast cancer there. You can learn about breast cancer, the introduction about breast cancer. So tomorrow we will be continuing about breast cancer, so that we sensitize people to how to avoid breast cancer. You know, breast cancer can be avoided. The only thing that people don't know is how. And you have seen some more people dying of breast cancer and cervical cancer. And there are things that we can avoid. If you go through the introduction of breast cancer today, some people are appreciating and they're saying, oh, so this is it. We will learn you can avoid getting these cancers just by knowing how your family is, your genetic makeup, and taking care of yourself because of your genetic makeup. Get? It's very important to learn these things. We avoid getting problems. So anyone, any last question before I log off? Any last question before Benjamin logs off? Any new person, please don't fail to subscribe. Don't fail to subscribe. Always subscribe to make us have a community. Anyone who feels can have any question, anyone who feels a question can drop any question, and I can answer you, and we feel good and we continue feeling nice. Anyone? I'm just taking questions today. I don't have a talk. I don't have a talk today. I'm just taking questions. Any questions that anyone has, please. Any question? Okay, I see today people are just listening and feeling nice. So you guys, let's continue with the topic on the cancer of the breast tomorrow. Wherever you are, even if it's daytime, it's night, it is. I see my sister where she is in Norway. It is at night, but it's not at night because they are now in Norway. There is light. The sun is buzzing, and you are saying good night. Yeah, that is funny. You have to screen the windows so that you can sleep with the dark curtains. Have a lovely evening. Let's meet tomorrow as we talk about, as we continue about breast cancer. But if you've not started, please go and check out how you can avoid breast cancer, because the introduction has really taught us a lot. So you can visit the guide of that video you did today and learn more. Bye. See you tomorrow, my friends. See you tomorrow. Bye-bye.